Construction of LUBOWA Specialized Hospital hangs in the balance as various stakeholders continue to fault Ministers of Health and Finance plus Members of Parliament for flouting procurement procedures. The agreement to build the specialized facility worth 1.3 trillion Uganda shillings was signed in 2015, with government facilitating the investor with a loan, and upon completion, Finance will own the facility for 6 years before giving it back to the government. The latest group to speak out after the Uganda Medical Association is the civil society. Joining us this afternoon is Faith Lumonya. She is the program officer in charge of trade and investment at the Uganda Debt Network. Good afternoon, Faith. Siatini. I beg your pardon. She is from Siatini. Good afternoon.
Good afternoon to you.
Now, the biggest question right now is, why are you asking for assessment benefit analysis now from the government?
Thank you very much. And one of the reasons why we are concerned about this particular case is because it's not a usual agreement. It's a public-private partnership agreement. And a number of stakeholders out there, a number of citizens out there are not aware about the fact that government has been signing and getting into a number of public-private partnerships. And yet they come with a number of implications, especially in as far as affecting our fiscal, further affecting our fiscal situation. So one of the reasons, we have a number of concerns that we are raising. We have concerns about the process because when we analyzed the report that was developed from the parliamentary meeting, one of the things that we realized was that while the Public-Private Partnership Act of Uganda provides for consultations with the committee, formation of a committee and consultation with it, but also with the PPP unit, that was not done. And so you realize that then the process basically contravened the provisions of the public-private partnership. But also one of the other concerns that we have is that this particular arrangement is such that it's our government that is going to bear the biggest risk. Because so many times when government gets into public-private partnerships, which we call PPPs, it's because they want support in as far as finance is concerned, financing as a particular investment, but also issues to do with efficiency. But in this case, we see that it's government that is now providing the finance through the promissory notes. And so it creates a number of questions. Why are we getting into this particular, why did we get into this particular arrangement in the first place? Because also the arrangement as it is will also affect the efficiency of the project implementation. Because if government delays on providing the finances, then there will be challenges in that regard. But also another issue that we have is the fact that the money that is supposed to finance this process in terms of the loan is supposed to come from the Ministry of Health annual budget. And we know that we've already fallen short of the Abuja declaration requirements of 15%. This year we are at about 8.9%, which is even much lower than last year's allocation. So there are challenges in as far as financing Ministry of Health is concerned, but also the entire sector. And then there are issues to do with the fact that the agreement says that if the government of Uganda does not live up to the commitments they have signed to in the contract, in this particular contract, then the case will be heard in London at the International Arbitration Court. And from the experiences that countries have had, because there are a number of cases that have been brought to these courts, and the experience is that it costs on average $8 million US. And if we are to be subjected to such a situation, then it will affect further our fiscal. It will throw us even lower in terms of our fiscal deficit. So one of the things that we are saying, because Parliament is saying that they have already approved the loan and government already signed the contract and there is nothing that can be done at this point. But one of the things that we are recommending is that there is need for government to do a cost-benefit analysis. They should weigh the losses and the gains. If and where these costs and these losses and gains in terms of now, if we are to terminate the contract right now or later. Because if we are to, if we fail to live up to the commitments later, then the cost is much higher than if we chose to terminate at this point.
So you're asking that they rethink their decision now?
That they need to rethink the decision right now.
What if they do not heed to this? What will it have on what effect will it have on our economy later on?
Because when you look at our situation as it is, for example, one of the hopes is that when the hospital is finally put in place, we as the patients are the ones that will be, it's the revenues collected from the services provided to the patients that go to this hospital that will finance the costs later on. But as it is, and considering our macroeconomic challenges, considering the poverty levels within the country, shall we actually be able to pay the bills that will necessitate us to be able to actually pay back this particular loan? So it's a bit funny, I may say, if I may use that word, because like I said, the arrangement puts the biggest burden on our government, and so it calls for concern.
Okay.
Yeah.
Clearly, you're not the only group that's asking for something, and perhaps the government is going to heed to the call now more than ever. Hopefully. Because the long-term effects are far much more grave than they might seem as of now. Thank you so much for joining us on NTV at One Faith.
Thank you too.
From Siatini, she is the program officer in charge of trade and investment in